gotta say action. Action. Knock, knock. Hi there, I'm Ellen. Am I going to be your nurse today? So, can you tell me your name and your birthday?
Taylor Sama, 3/17/93.
All right, and that matches up. So today we're going to do a skin, hair, nail, peripheral vascular assessment. Peripheral vascular means circulation. So, all right. So I'm going to start out first by looking at your hair. And can you, we'll leave it up there, huh? Because it's hard to take it down. So, and I see that you have kind of blonde highlights and dark brown hair. Is that your normal hair color?
The brown.
The brown is, yeah. So it looks shiny. It's kind of a coarser texture. It looks evenly distributed. Do you have any areas of hair thinning or hair loss?
Nope.
No? Okay, and have you noticed any sores or moles or lumps or bumps in your scalp or hair?
Nope.
No. Okay, and I don't see any highlights. Alright, now we'll move on to skin. And I'll see that your overall skin tone looks consistent with your ethnic background of Caucasian. That's what you told me earlier in your history. Is that right? So I see you have some piercings, 3 on this ear and 3 on this ear. Yeah. I don't see any other piercings or tattoos. Do you have some anywhere else?
Yeah, I have 2 tattoos. I forgot about piercing.
Okay, and your tattoos are, where are they?
Yeah.
Okay, so we'll look at that later when we do the skin of your chest and abdomen. So your overall skin tone, as I said, is consistent with your ethnic background. I don't notice any generalized color change, like you don't look flushed or pale at all. And I don't see any areas of hypopigmentation. And we'll look more closely at your arms and legs when we come to that. For hyperpigmentation, I see you have a scattered, there's a papule, there's a macule, a few other scattered papules on your face here. Those are mildly erythematous, that means red. Here's a brownish papule. You have a couple other scattered papules.
Got a rash.
Yeah, you have some excoriations here. So, all right. So, okay, I'm gonna then move on to your arms, actually, and I think I'll have you just rest them up here to just be easier to see. Just put your arms up here. So, and again, the skin color of your arms looks pretty even and consistent with your overall skin tone. I don't see any areas of hypopigmentation, but you have some hyperpigmented areas.
Those are scars.
So it's an erythematous linear scar there. You have a couple scattered macules here. And more scattered. Here's some linear excoriations. There's some atrophic tissue.
I scratched myself.
Okay. Here's a few other scattered macules. Have you noticed anything changing or different anywhere?
Nope.
On your skin? Okay. I notice when I feel here that you have some roughness on the posterior aspect of your arm. Otherwise your skin is smooth and warm. Warm throughout. Your skin is dry. You're a little moist at your fingertips. So you don't notice any areas of swelling. Have you noticed anything that's swollen at all? No, I don't notice any areas of thickness. Sometimes people have calluses. I don't see any of that. I'm going to check your skin turgor. That's a mark for how hydrated a person has. And your skin folds right back down, so that says you're well hydrated. I'm going to check your pulses here. Your arm. So this is the brachial pulse. And those are a regular rhythm. And they're symmetrical, the same from side to side. They're 2+, that's normal strength. I'm also going to check your radial pulse or radial artery here. Same anything that's 2+, other than this regular, that's a normal strength and they're symmetrical. So, let me see how your fingernails look here. They're rounded and smooth. The angle is 160 degrees. I'm going to check your circulation by capillary refill. That just means the color comes right back. Yours is less than 3 seconds. Again, smooth, rounded. Your angle is 160. And the capillary refill. I see you have fingernail polish on. Clear. But we can assess through that. Your capillary refill is less than 3 seconds. So I'd like to look at your legs, so I'll have you lie down here.
They're a little hairy. Didn't think that.
I always tell patients I've seen hair on legs before, so I'm not going to be alarmed. So again, I look and I see that the color, again, looks totally consistent. The skin is dry. You have a little roughness here also. Here you have an atrophic scar. Same way here. Yeah. You have a couple of scattered macules. Nothing changing or different on your skin that you've noticed, huh?
Nope.
Lift your leg up here so it's good. I don't notice any hypopigmented areas, just those hyper ones. So the temperature is uniformly warm. And as I noticed, it's there's a little roughness here, but otherwise smooth and dry. I don't notice any swelling anywhere. Have you had any kind of swelling?
Nope.
I'm going to check for edema now, though.